The Georgetown Public Hospital Corporation is now a certified kidney transplant center. The center was conferred through the Ministry of Health in conjunction with the Human Organ and Tissue Transplant Agency. With support from these organizations, GPHC has become the first hospital in the country to achieve this milestone. Health Minister Dr. Frank Anthony said the country's healthcare must meet international standards, and in recognizing this, the hospital can now compete on this level.
Of course, while we've been doing a lot of good work, we also need to make sure that it's compliant with international standards. What we have done here and that extensive process that Dr. Samaru just went through is verifying that we are meeting all the international benchmarks that exist in other parts of the world.
The establishment of the Human Organ and Tissue Transplant Agency was made possible through the enactment of the Human Organ and Tissue Transplant Act 2022. The agency's members were officially gazetted in February 2023, with their appointments taking effect in April of the same year. Dr. Anthony said the agency's team has worked ardently to push the barriers and ensure that kidney transplants in Guyana are advanced. Several collaborations with the Pan American Health Organization, PAHO, among other international stakeholders in the medical fraternity, were key factors for the level of service attained.
And because of these arrangements, we have been able to put a lot of measures in place. So as we go forward, moving from living donors to cadaveric transplants, I think the public can rest assured that we are adhering to all the best international practices.
Chair of the Human Organ and Tissue Transplant Agency, Dr. Shanti Singh, said the agency is already engaging with dialysis centers that can further engage persons with kidney disease to consider transplants.
We've also had several consultations with key stakeholders. To note, we've had consultation with dialysis centers so that staff of dialysis centers can begin to think about transplantation and can be able to talk with their patients about transplantation. We've also commenced a medical education program for different categories of healthcare practitioners through medical education session.
To ensure that the procedures are of high standards, there was a lot of investment in capacity building and acquiring regulations to operationalize the Act. There are 7 drafted regulations, and the training of staff to perform for the transplant program is ongoing. Meanwhile, to further advance the training of the medical fraternity in kidney transplant and nephrology, the government of Guyana is seeking partnerships with countries like Spain and Brazil. Reporting for the newsroom, Lazeena Yearwood.